The two approved COVID-19 vaccine. Number 1 is, the Chinese company CanSino Biologics, developed a vaccine based on an adenovirus called Ad5. In partnership with the Institute of Biology at the country's Academy of Military Medical Sciences. In May, they published promising results from a Phase 1 safety trial, and in July they reported that their Phase 2 trials demonstrated the vaccine produced a strong immune response. In an unprecedented move, the Chinese military approved the vaccine on June 25 for a year as a specially needed drug. CanSino would not say whether vaccination would be mandatory or optional for soldiers. On August 9, the Saudi Health Ministry announced that CanSino Biologics would run a Phase 3 trial in Saudi Arabia. The company is in negotiations with other countries for more trials. Number 2 is, the Gamaleya Research Institute, part of Russia's Ministry of Health, launched a Phase 1 trial in June of a vaccine they called Gamcovid-Vac-Lyo. It is a combination of two adenoviruses, Ad5 and Ad26, both engineered with a coronavirus gene. In July, the chair of the upper house of Russia's parliament announced the country might start vaccine production by the end of the year. On August 11, President Vladimir Putin announced that a Russian healthcare regulator had approved the vaccine, renamed Sputnik V, before Phase 3 trials had even begun. Vaccine experts decried the move as risky. Nevertheless, TASS reported, Vietnam soon agreed to purchase 50 to 150 million doses. The vaccine testing process. Preclinical testing. Scientists give the vaccine to animals such as mice or monkeys to see if it produces an immune response. Phase 1 safety trials. Scientists give the vaccine to a small number of people to test safety and dosage as well as to confirm that it stimulates the immune system. Phase 2 expanded trials. Scientists give the vaccine to hundreds of people split into groups, such as children and the elderly, to see if the vaccine acts differently in them. These trials further test the vaccine's safety and ability to stimulate the immune system. Phase 3 efficacy trials. Scientists give the vaccine to thousands of people and wait to see how many become infected, compared with volunteers who received a placebo. These trials can determine if the vaccine protects against the coronavirus. In June, the FDA said that a coronavirus vaccine would have to protect at least 50% of vaccinated people to be considered effective. In addition, Phase 3 trials are large enough to reveal evidence of relatively rare side effects that might be missed in earlier studies. Approved. Regulators in each country review the trial results and decide whether to approve the vaccine or not. During a pandemic, a vaccine may receive emergency use authorization before getting formal approval. Once a vaccine is licensed, researchers continue to monitor people who receive it to make sure it's safe and effective. Combined phases. Another way to accelerate vaccine development is to combine phases. Some coronavirus vaccines are now in Phase 1/2 trials, for example, in which they are tested for the first time on hundreds of people. Note that our tracker would count a combined Phase 1/2 trial as both Phase 1 and Phase 2. Anyway, this is good news for us, because somehow it is gradually giving us hope to live a normal life again. Please put a comment below and hit the like button. And don't forget to subscribe. Thank you for watching.